Good morning. My name is Adeyinka Okonkwo, and this presentation is about the benefits of implementing electronic health record systems. The reason why this implementation is important is because medicine is a dynamic discipline, and these days there's emphasis on digital technology. Apart from that, electronic health records have been known to help in giving better decision and more coordinated cares, and at giving the providers evidence-based tool that they need to make decisions about their patient care. Last but not the least, there are a lot of success stories that have been identified with implementation of electronic health records. And I have a feeling that as a hospital that wants to provide good quality care to our patients and still be able to save cost while doing so, we need to implement electronic health records. This audience comprises of clinicals, instructors, the doctors, the nurses, and the management of United Medical Center. The reason why we chose this audience was because nurses play an essential role in implementing electronic health records. The doctors and hospitals are big beneficiaries of electronic health records. Electronic health record is also a major initiative of healthcare organizations, and then it affects the way the doctors and the nurses do their job. So that is why it's important for us to implement it, and that is why this audience is very important to the implementation of electronic health records. Before we start on why we need to implement electronic health records, let's first of all find out what electronic health record is, because some people might not even understand what we're talking about when we said electronic health records. So electronic health records is the digital record of health information, is the simplified sharing of updated real-time information. It allows a patient to move with their medical information in case they need to move from one state to the other. And it gives the providers the access to the tools that they can use for decision making. Now let's talk about the benefits of EHR implementation. Why do we need to really implement EHR in our hospitals? According to ONC 2017, the benefits of EHR are improved patient care, increased patient participation, improved care coordination, improved diagnostic and patient outcome, efficiency and cost savings. In the area of cost savings, the emphasis in all the healthcare institutions now has been to give evidence-based care to the patient and still be able to save cost. We want to save cost by reducing the number of tests we give to the patient, save cost by sending the patient home, by reducing hospital stay. We send them home on time and still send them home in good health. And then we want to reduce the time it takes for them to come back to the hospital. Those are very important in saving costs, and that is one of the benefits of implementing EHR. So we are going to take the benefits one after the other and look at how electronic health records have been able to do that. The first one is the improved patient care. According to ONC 2017, electronic health records have been able to improve patient care by accessing patient records quickly, enhancing clinical decision support, supporting performance improvement, ensuring legible, complete documentation for accurate coding and billing, promoting safer and more reliable prescribing. In issue of ensuring legible documentation, there has been cases where the writing of the doctors has been read wrong, and as a result, it has led to wrong medication being given to the patient. And when we have electronic health records, we'll be able to read the documentations legibly, and as a result, we're able to make our patients safe. Increase patient participation. Electronic health record increases patient participation by ensuring high-quality care, creating an avenue for communication with patients, allow providers to carry patients along, using effective communication to identify symptoms early. Providers need to make sure that the patient have a say in the type of care they receive. When you carry them along, they'll be able to contribute to their own care, which is very good. And when they contribute to their own care, we are able to get them to comply, to have 100% compliance with the care. It's also important to have effective communication with your patients and family members. With that, they'll be able to open up to you. And when they open up to you, they'll tell you all the things they are going through. And that has been able to help to identify symptoms early. And when you identify the symptoms early, it will lead you to the type of care that you think the patient will need to be able to give them the quality care that they deserve. Improve care coordination. Electronic health records has helped to improve care coordination by decreasing the fragmentation of care, promoting the potential to integrate and organize patient health information, facilitating instant distribution among all authorized providers, ease of transition of care, reducing medical errors and unnecessary tests. If, for example, a patient has been to one ER to do a diagnostic test on one particular symptoms, if the patient moves to another state, there should be no reason why the test should be repeated. That test should be able to access by the new hospital, and that can able to help the provider in giving the right diagnosis to the patient. Practice efficiency and cost savings. Electronic health records promotes efficiency and cost savings by reducing transcription costs, reducing chart pool, storage and refilling costs, improving documentation and automated coding capability, reducing medical error, improving patient health and quality of care. Lastly, we are going to look at how electronic health record has helped to improve diagnosis and patient outcome. Electronic health record ensure improved diagnosis by aiding in diagnosis. It aids in diagnosis because you'll be able to compare different diagnoses based on the symptoms that the patient is complaining about. And you can do that by logging it to the computer. Once you pull it up, you see what other care providers have done with that type of symptoms that your patient is having. Reducing error, improving patient safety, it supports better patient outcome, and it prevents risk management and liability. If a patient is rightly diagnosed and right medication and right treatment is given, it will reduce liability. You don't have to get sued for giving a wrong diagnosis to the patient. Now we are going to look at the relationship between health information exchange and electronic health records. But before we go ahead to that, I just want to briefly point out what health information exchange means. Health information exchange allows healthcare professionals and patients to access and securely share medical information. Some of the benefits that we get from using health information exchange are promotion of access and confidentiality, share patient information, promotion of safe and effective care, tailored uniquely to patient medical record. So in this case, there have been issue of HIPAA violation when using electronic health record. But with the training that staff have been receiving when they are implementing electronic health record, HIPAA violation has been reduced to a BRS minimum. Now let's go to the relationship between health information exchange and electronic health record. Both has helped immensely to improve medical decision making. Both increases efficiency. Both coordinate the storage and retrieval of patient record from multiple health sources. Both help to keep vital medical information required for critical decision making processes. In electronic health record, because it involves using of hardware and software. Each staff is given a code to which they can access the software and hardware of the company. And when you have given that code, it is your job as a healthcare provider to keep that code safe. First, you cannot share your code with somebody else, so that will prevent an unauthorized user to access a patient's medical information. The code must be changed periodically, just in case the nurse or the doctor is no more in the employment of the organization. And another thing is, the code must be kept safe. You should make out a code that nobody else will be able to identify. It's only for you to be able to identify the patient's information. And you are supposed to give it safe. It's part of the job responsibility. Now, despite all the success stories identified with implementation of EHR, there's still some barriers that we face when we want to implement EHR. I don't want to just talk about the benefit, and not tell the hospital and the management what are the barriers that we are expecting when we eventually implement this EHR. One of the barriers is finance cost. Money is needed in the implementation because you have to purchase and install the hardware and the software that will be needed. You have to convert paper charts to electronic ones. That costs money too. And then training end users cost money. The nurses will have to go for the training, and while they're on training, one of the incentives we normally give is to make sure that they get paid for the time they are in class. Otherwise, they will not go to that class to train. And another problem that we do encounter is the description of workflow. And that happens when we are training staff to be able to use EHR. And then there's temporary loss in productivity when you change from one paper chart to the electronic one. There's risk of patient privacy violation when we are doing that change. And then the change too might cause over-dependence on technology. The last but not the least is maintenance. Technology changes periodically. And because of that, we have to change the software, to update the software and the hardware that we are using. Even the one we buy, by next year, there may be a newer version of it. And there is the responsibility of the hospital to be able to upgrade to the newer version. Some of those things cost money. But the thing is, when we look at the long-term benefits of EHR, the money or the barriers to it, to implementing it, is something that the hospital should be able to deal with. Lastly, I'm going to talk about the success stories that has been associating with implementing EHR. First, the government give monetary incentives to hospitals and doctors. That has helped them to ease the initial burden of implementation. And because there's a lot of new version of hardware and software in the market, it has reduced cost drastically. Another thing, the last but not the least, is some of the people that have implemented electronic health record, the success stories that they have recorded. Dr. Asinski recorded success in his practice, despite the challenges that he had when he was trying to implement it. And his main challenges was in the training of end users. Some of the workers that he have with him at the time of implementation are not computer savvy. So they have to get trained to be able to implement EHR. Another doctor, Dr. Ipen, was able to record success in his small-scale practice after implementing EHR. The last but not the least is St. Christopher's Hospital in Pennsylvania was able to reduce patients' wait time by 20%. And not only patient wait time, they are able to reduce the hospital stay of the patient drastically using EHR, and they sent them home in good health. So when you implement EHR, you increase the hospital revenue, because the patient that you treat will go out there and tell the others about the type of care that they receive in your hospital because of the EHR you are implementing. And that will help increase the revenue of the hospital. And then you'll be able to reduce the hospital stay for the patient. When you reduce the hospital stay for the patient, you save the patient money and you equally save the hospital money. Because when a patient is staying in the hospital more than required, there's problem of having a hospital-acquired infection, which is, by the way, is not reimbursed by Medicare, Medicaid. And then the last but not the least, when a patient satisfaction is improved, is equally improved the family satisfaction. If you are practicing holistic care, EHR has helped greatly to improve communication between family providers when they are practicing holistic care. With all these success stories that are associated with EHR implementation and the benefits that we stand to gain, I hope the hospital will consider implementing EHR in the nearest future. Thank you for your time.